So it's been a while since it went live, but something came up today in the clinic and it kind of made me mad. So I'm doing a video because I want everybody to know there is a way out. But the question, well, it wasn't a question, it was a statement, but it's all about why other treatments don't work or have failed for back pain, because they fail. A lot of them. Most of them, if it's a serious back problem, fail. Ours doesn't. But I had a patient come in and told me, this is really sad, told me that their doctor said, pain's in your head. Get over it. So they said the low back pain and the pain that was going into the glutes, like beginning of sciatica, was in the patient's head. And they said, well, why did they say that? They said, because I had tried other treatments and I didn't get better and they didn't see anything terrible on the MRI. That's ridiculous. You cannot have back pain that's in your head. They did a study once with workers and they found out that the workers who hated their jobs the most tended to have more back pain. Okay? But that doesn't mean the pain was in their head. And it's possible they hated their job because it caused their back pain. Every back pain has a cause. So, why do they fail? We did a study, 1,200 patients. Not 12, not 120, 1,200. That's a lot of people. And they all had failed other therapies before getting into our therapy. So they failed, 1,200 patients had failed other therapies. Why did they fail? They failed because they weren't treating the spine the right way. We know, and what we've learned, is that the spine, when you move it, will cause the disc to move. And if you know which way it's moving, you know which exercises are best, which is what helps us get the best possible results for you, both in our clinics and at home. We have exercises and things you can do at home. You just have to identify what position makes you worse. So why do I do this? Why do I do these videos? I do these videos because you're getting bad advice. Quite frankly, I see it every day on the internet, on YouTube. People giving you bad advice. It's just flat out wrong. They're telling you to do things that are going to make you worse. Sometimes they make some people better, but sometimes they make some people worse because we know that the discs will move. So if they give you a bunch of flexion-based exercises and flexion makes you worse, guess what? It's not going to get better. Had a patient fly in from Mexico, had gone to the top spinal expert in Mexico City. Gave him all the wrong exercises. I said, it's real simple. Stop doing those. Start doing these. Go through the program. Got better. Got 100% better. It's a shame you had to fly this far to figure that out, but it's not that uncommon that people do that. You're getting bad advice. That's why I do this. We discovered with motion to the MRI that the disc will move. It'll get bigger and sometimes it'll get smaller. And that's what dictates how it has to happen. 24 vertebrae, in between each vertebrae there's a disc. The disc is like a jelly donut. It will move. As it moves, you need to avoid the activities that push the disc out. Posture, movement habits, sitting too long. We live in a culture where we sit all day long. Okay, sitting is bad for everything. It's bad for your back, it's bad for your heart, it's bad for your brain, it's bad for your lungs. Sitting is bad. And the sitting will take its effect on your spine. So there are certain things you can do. We have a program 10X. You can start doing these things at home. I have everybody who flies in to see me, I have them start this process at home. They can get things functioning better. Helps you feel better. Start to create stability. It's learning about your spine. It's learning what you can do and can't do, both by the education that we give you, but by you doing the things and filling out the questionnaires. We have questionnaires. Why do you have back pain? Because you have bad habits. Not your fault. It's like not ever learning you had to brush your teeth and you just have bad habits of never brushing your teeth. Once we teach you to brush your teeth, brush them every day. Same thing with the spine. There's a certain hygiene to your spine, meaning there's certain things you do to make it better and certain things you'll do to make it worse. So our goal is to unload the disc, to stabilize the spine and get the nucleus to move back to the inside. The most severe advanced cases get better with our program. We have the ability. I just went the wrong way. I suffered. 10 years I suffered. I found a way out. Okay? My way out was my way out, but we found out that there are other ways out. Now we know all the ways out. There's a pathway you follow. Follow the path, you can get out. We can do this for you. You can come into our clinic, we can do it for you, or you can do it at home. Both are effective. I know a lot of people can't come to Chicago. We're opening up other clinics though, by the way. Okay. I suffered herniated disc, bulging disc, degenerated disc stenosis. Put together a program. It's very effective. We have 3 scientific studies, major studies. We talked about the one with 1,200 patients. Each one of those patients had failed. Oh, I didn't mention this. I'm going to go back. Someone said, don't do that. So 1,200 patients, 312 had failed surgery. We can help you even if you failed the surgery. Why did the surgery fail? Because they didn't stabilize the spine, they didn't strengthen the spine, nor did they identify what's going to make you better, what's going to make you worse. And very often you go right back to the old habits, guess what? Pop that disc again. Every single time. Failed back surgery syndrome. The most complicated back problem you can have. We can help you. The goal is to unload the disc by doing the exercises. Knowing what you have to do. They're giving you the wrong advice. Why? Because they don't know. And why do they say it's in your head? Because they can't fix it. I met a patient. I didn't meet a patient. I met a person at a party, at a birthday party. They said, oh, I've had this back problem, and they've been giving me this exercise, and I've been doing it every day. I said, how are you feeling? I'm getting worse. Asked a couple of questions. I said, you know what? You're doing the wrong one. Switch it. Followed up. A month later, how you doing? Feel great. It's that simple. Okay? There's levels of understanding of back pain. To fix your back pain, you have to understand it, especially if it's failed. If you've failed other therapies and you're not getting better, you need to understand it. What do you do to understand it? We have an educational process. We have all the tips, what you need to know about your spine. It's in 10X. Okay? If you can't come into the clinic, go to 10X. Okay, I have the link. Here's the link. totalbackpainrelief.com/10X. Why is it 10X? Because the second study that we published proved that we are 10 times better than traditional physical therapy. Because we know what positions make you better, what positions make you worse. That was the breakthrough. Everybody should know this. If you don't know this, it's possible to get it better. That's what you need to know. Share this information. It's a breakthrough. Share it, live it, be part of it. I want you to share this video. Ask any questions. You can comment on it. Sign up for the 10X. My goal is to eliminate back pain from the planet. My goal is to help educate doctors. They're giving you bad advice. General practitioners, orthopedic surgeons, pain med guys, pain specialists, chiros, PTs, massage therapists. They're giving you bad advice. Okay? There is a way out. Kind of makes me mad because it's not like it's hidden. It's not hidden. It's available for everybody. That's my rant. It was a rant for today. That's it. Today is Tuesday. We'll do another one tomorrow. It's been a while, so I'm going to try to go live every day. That's it. Be careful. Enjoy the day. Thank you.